Our next panelist is Sonja Nesbit. Sonja has decades of experience on the Hill and at senior levels at HHS. She's currently managing director at FTI Consulting, which is a independent global business advisory firm. Sonja, thank you so much for joining us this morning. What do you think healthcare leaders can expect from federal policymakers in the coming year?
Thanks, Christoph, and thank you everyone for inviting me to participate. Enjoyed the discussion. You know, there's a lot to think about. I think Dean has laid in Norm as well a great overview and a landscape of what we can expect from the federal level. You know, I'm going to talk a little bit about how that translates down to the provider level. I'm going to say at the onset, though, that the uncertainty described by Dean and by Norm will continue to be felt at the provider level, given there's just so much perspective change that is occurring in DC. But with that, sort of let me begin here. Healthcare providers, health systems, hospital systems, and other healthcare stakeholders face a challenging outlook this year, as we've been discussing. Service delivery models, which have previously been the subject of continuous discussions about reform, beginning with the passage of the Affordable Care Act, have been upended over the last 2 years due to the COVID-19 pandemic. And while the federal government has stepped in at an unprecedented level of funding, and also by extending a number of flexibilities to providers and hospital systems to help them respond to the circumstances surrounding the pandemic, it's not clear how long these flexibilities will last, many of which are tied to the public health emergency. And it's just going to be particularly tricky given that there is a reliance on many of these, particularly in the telehealth space. And to add to the uncertainty that lies ahead, we are roughly, as Dean just forecast for us, 10 months away from a congressional midterm election that will likely reshape the composition of the U.S. House of Representatives, maybe the Senate, with congressional Republicans poised to take control and advance priorities that are widely different than anything that might be embraced by President Biden on a variety of healthcare matters. Chief among them, the federal government's response to the pandemic. Many, but not all of the members of the House Republican Task Force that Dean highlighted very helpfully in his remarks a few minutes ago, those folks who are poised to be influential players in 2023 are people who have been very critical of the president's response, President Biden's response to the pandemic, and also have gone as far as to question the origins of the COVID-19 virus, that have made comments that don't necessarily inspire a lot of confidence in their inclination to work with President Biden or to identify and advance prospective bipartisan healthcare legislation to continue to move forward. Congressional Republicans obviously will not seek to be helpful to the president as all eyes turn to 2024, where both parties will work overtime to make sure you and the rest of the public are aware of their differing views on the future of the healthcare system in the United States. Now, this politicalization of the federal government's response to the pandemic, which unfortunately has been framed in a very politically intense discourse, and has led to a great deal of animosity and even distrust in science and among healthcare or with healthcare professionals, has made it nearly impossible to have a substantive discussion about promoting and advancing innovative health service delivery models, ways to build on reforms that have already occurred in the last decade or so. Yet, despite that increasingly depressing view that I started off with, I don't think all is lost. To Dean's point, I do think there could be some opportunities to see a few things happen. We'll see, but I do think there's a perspective out there that says things could continue to move along. Members of Congress continue to debate the prospect of doing additional health policy in a variety of areas that are designed to support healthcare systems in response to the pandemic and in response to a variety of other things that are both old and new that have gained the attention and support of federal policymakers. Now, and Dean mentioned this as well, President Biden and congressional Democratic leaders are really running out of time to advance any of the healthcare agenda that was included in the Build Back Better package that has stalled, or actually not even stalled, but it's met its demise in the Senate. And while they're running down the clock on moving any ambitious, progressive leaning policies as their time winds down on their control of both the executive branches and both branches of Congress, I still think, as I said beforehand, we could see some modest movement. Right now, there seems to be a continuing question about whether or not they will make any attempt to resurrect any of the healthcare policies that were included in the Build Back Better package that passed in the House of Representatives in the fall, including extending the ACA marketplace subsidies, closing the Medicaid coverage gap, and extending maternity care and postpartum coverage to mothers on Medicaid, which has been identified by a number of congressional members as particularly helpful in addressing health inequity and some internal concerns there. Nonetheless, while the administration and Senate Majority Leader Schumer and House Speaker Nancy Pelosi debate what they're going to do in terms of moving forward with the Build Back Better package, we've seen many members of Congress, many influential members of Congress have already pivoted to other policy initiatives that have bipartisan support. Some examples include the workforce shortage, which is, as everyone here on this seminar knows, is not at all a new issue, but one that's become much more pronounced, obviously, with the pandemic. Many of you might be pleased to hear that there is discussions in Congress on how the healthcare workforce shortage, physician burnout has an impact on the healthcare delivery system. You may not, though, be surprised to hear that there's not yet a consensus on how to address it. But perhaps you should take some solace in the fact that acknowledging that there's a problem is really the first step in getting to a solution, and that has begun. So we'll look forward to seeing what comes out of that. There also continues to be a great deal of focus and attention, particularly in the administration, with promoting and undertaking initiatives to address health equity and promoting social determinants of health. This is not a new issue. It started during the Obama administration. It continues to be an interest among a number of folks in Congress. Again, given that these disparities have been particularly pronounced in the last 2 years and need to be addressed in many ways if we're going to get to greater equity in the system. And as Dean pointed out in his remarks, there also is a great deal of interest to advance federal policies to ensure greater parity in mental health in substance abuse services, to allow what Congress to address what one powerful lawmaker termed as the mental health crisis that's unfolding in the United States. I know Norman mentioned this as well. Again, I think there's a great deal of opportunity, particularly out of the Senate, to advance those particular policies. And right now, we know there's been at least 5 congressional hearings on this particular topic, with another one just scheduled this morning in the House to look further at substance abuse issues. And finally, the popularity of the flexibilities that have been provided at the start of the pandemic with the use of telemedicine means the policy is likely here to stay. Obviously, it's growing in terms of its popularity and its use among both providers and patients. So, we can anticipate to see some level of additional continuation as this is decoupled away from the public health emergency, as Dean mentioned. Many congressional lawmakers actually view telehealth as a viable option to addressing a host of issues, particularly as it relates to increasing greater access to services for people who are living in rural communities, as well as providing additional resources to critically get out mental health services to meet the high demand that we're experiencing right now. I would caution us all to know, though, that the Biden administration is likely to be a little bit more circumspect about how they make some of these changes permanent, given they continue to have concerns about the lack of guardrails related to ensuring integrity in the billing of these services. But I don't envision a scenario where they move away from this policy. So these bipartisan discussions are happening because influential healthcare stakeholders, including healthcare providers, hospital systems, patient advocacy groups, have found a way to weave through the difficult political terrain that currently exists and found success in helping to initiate and advance discussions on areas of emerging healthcare needs, such as the mental health parity debate and health equity. Certainly, weaving through these dicey political additions to influence policymakers have been an incredibly challenging task, to say the least. Informing the debate is particularly difficult as the traditional methods of doing so, with engaging directly with your policymakers, have been impacted by limited access due to the pandemic, and which we haven't discussed that much, the aftermath of the January the 6th insurrection in the Capitol building, which has effectively shut down most of the public access to the Capitol due to security concerns, ongoing security concerns. But I do think as the country begins to open up again, there will be ample opportunities to re-engage with federal policymakers, particularly during the election year, who will be particularly interested in hearing from their healthcare stakeholders, so they can better understand how to pivot to a legislative agenda and regulatory agenda in a post-COVID world. Meanwhile, I think it's been particularly impressive is that we've seen a great deal of ingenuity at the state level, as many states have taken actions that have essentially lost any traction in DC, and instead have taken their own ingenuity and their own focus and push to make things happen at the state level. Providers and healthcare systems in California are seeing a great deal of movement at the state level, which, like other states, has become, as I said, an incubator for healthcare policy, particularly on initiatives that reflect the political views of the states. A few examples in California, you all know about this, obviously, is the insulin cap sharing initiative. There's been a great deal of appetite at the federal level to address drug pricing, but very little in terms of coming up with viable solutions that can get passed into law. Some of that reflects the strong arm of the pharmaceutical lobbying industry, and some of it reflects the hesitation of policymakers to really do anything. So, again, we're seeing not only California, I know Michigan and other states have also taken a look at insulin caps, and again, we're seeing great movement there. In California, healthcare coverage, timely access to care proposal, which became law in October, which will become law, in October, requires health insurers across the state to reduce wait times for mental health care, which is incredibly impressive. And I think, again, as we see more focus on this debate about getting that type of service out to folks, we might see more states take action as well. And of course, the big kahuna, if you will, here is California's not continuous attempt, but its attempt to have a single payer healthcare system in its state. Now, I know it's not gotten the support needed in the last legislative cycle, but I believe there's some expectations about its return. I know Amy may speak more about that later. But the great news for California providers and the healthcare systems that are there is that there is great appetite at the state level to move forward with innovative healthcare policy solutions to address the needs of the community and improve upon the healthcare service delivery model, where those discussions again are stalled in DC. But I think it's worth noting, as Norman mentioned in his remarks, that as states continue to move forward in advancing healthcare priorities that meet their political ambitions, we will see greater disparities in healthcare outcomes across the country, which will, again, be dictated by where you live, which is incredibly unfortunate. But I think it's just a political reality of what we're going to see, and certainly will have an impact on providers and the healthcare delivery models throughout the country. And with that, I will turn it back over to my friend Christoph.
Thank you so much, Sonja.